You've probably heard the word inflammation, and I was talking to a new patient the other day, and he was like, what is inflammation anyway? And it's just one of those moments where you go, that's right, we throw this word around a lot, and what is it and why is it so important? And if you want to live a long, healthy life, you want to be energized, you want good mental clarity, and you don't want chronic disease, you really need to understand inflammation. And there's two sides to it. So the good side of inflammation is you get a cut and your immune cells rush to that area because bacteria has entered, and they're just all over that bacteria, killing it. And if you think of the word inflammation like a flame, it gets hot, right? You get a cut, it's a little red, it's a little hot, like a flame, and that is your immune cells doing exactly and precisely what you want them to do, which is rush in and kill the bad guy and be very, very quick about it. So that's the good side of inflammation. It's acute, meaning it's fast, it's rushing to the site of some sort of injury or trauma and handling these foreign invaders, so something that's coming from the outside in. So that's healthy. We love that. That keeps us very robust. Now, what we don't like is chronic inflammation. So this is when your body is secreting inflammatory chemicals for something that's not there. So there is no foreign invader. It's just chronically doing this. And unfortunately, what happens is, oh, hello. Thank you. I'm new at answering questions, so let's save questions to the end, and then I can review them. But thanks for being here. So what happens with chronic inflammation is that, again, your immune system is rushing in to handle something day after day after day that's not there. So you didn't get a cut, you didn't get a trauma. So what stimulates your immune system to do this chronically, that's very important, because what the result of chronic inflammation is all those chronic diseases we don't want. And that's cancer, diabetes, heart disease, Alzheimer's, autoimmune diseases. Yeah, that's a good list. So these are all these chronic diseases we don't want, and it comes from this chronic flame, if you will, this chronic fire that's occurring inside your body. And why? So that's what's so important, is to get to the why. Before we do that, what are some of the symptoms of chronic inflammation? You can have abdominal pain, fatigue, joint pain, skin rashes. What else is on my list? Chest pain. And so it's a longer list, but it's not like when you get a cut, or a cut's not healing and it's starting to look pussy and infected, and you go, wow, I might need some more help, like my immune system didn't handle this. Chronic deep-seated inflammation is more the symptoms I just mentioned. And so again, why do we have chronic inflammation, and why is it really killing us in this country? Our diet, you hear me if you follow this channel, but it's not something that can not be reviewed over and over and over again, because you can't eat highly processed foods loaded with sugar, loaded with chemicals, and just full of things that make it a non-food. You can't eat that way and not expect your immune system to say, what is this? And that's what's happening with the terrible food, the processed food that we eat with all these chemicals in it, is that the immune system is attacking your very food, and it becomes part of your body and therefore attacking you. The other thing that happens is just poor lifestyle habits. So you're sedentary, you don't do any exercise. Exercise is very empowering for the immune system. You don't sleep well, and I very much understand the desire to sleep well and leaving enough time for sleep, but still not having good sleep quality. That's where we come in handy as far as getting to the real root cause of why. But some people just abbreviate their sleep, down and down and down, and just go, I can kind of get by on 4 or 5 hours, and yeah, I think I'm fine, and you're not, because that is when your immune system comes out and cleans house, handles chronic inflammation, is at night, when you're in a deep sleep. What else did I want to go over? Oh, alcohol use is just, it's another toxin, so it's just adding up on the toxic burden of things. Obesity, and I know that's a big one, and people struggle, but the bottom line is when what we find here at the clinic, and we've been doing this for 40 years, is that as you restore balance and function to the organs of the body will start to find its normal weight. You know, I'm not saying you need to look like a supermodel, but the belly weight. You know, if you have a big butt, whether you like it or not, that's not the deleterious weight. Weight carrying fat and excess weight in the butt, in the thighs, that's fat that's not going to go anywhere. It's in the torso, so between your shoulder blades and your hip, that middle area, that's the dangerous fat because it infiltrates into the organs. So we, you know, not that we want to be overweight, but it's also the distribution of where the fat is, and if it's in that torso area, that's the dangerous type of fat. And cleaning up your diet, drinking more water, getting more active, and I know these are things that I'm throwing out that you go, oh, I wish this is the bane of my existence, but I mean, that's really actually why we have the team that we have at over 40 years. That's why we've developed the fact that we have a physical medicine side of the clinic. We have registered dietitians who work with all our patients, because changing your life is, you know, it takes a lot, and you need to have your hand held through that process in those early few months. And then you get your momentum and you're feeling better, and it's much easier to sustain those good habits. But developing good habits, you know, estimation like 6 weeks, 90 days, it takes time. And we also have to find out what's really at the root of it for you. One part of chronic inflammation is chronic infections. We talked about acute infections like getting a cut, but deep-seated infections very often in the gut that haven't been identified, that need to be handled so you can take that stress off the immune system. Also toxins, so whether you've been exposed to mold or heavy metals or some other toxin that is in your system, and that is keeping your immune system in this revved up, inflamed state. So there's a lot of nuances to this as well. Like when I do these videos, I try to give you ideas that you can take away and start doing something with right now. But if you've tried some things and it's just really not working for you, then that's where we can help you and very much personalize a program to you. Because, you know, there's plenty of people say, oh, I tried this, I tried that, it was great for me. And you go, great. And, you know, a woman came in yesterday with her 80-some-odd-year-old mom, and mom was the patient, and the daughter was like, you know, I could tell I was kind of going down the path of my mom, and I didn't want to. And she said, I just started eating fruits and vegetables and real food, and I got off all the junk food. And she goes, all my symptoms went away. And you love stories like that, and that's when you say, it doesn't have to be difficult, it can be easy. But what if you've tried some basic lifestyle and diet changes and it's not enough? Don't give up. It doesn't mean you're stuck. It just means you need a little more help. So we'd be delighted to help. And yeah, please give me feedback on topics and what you want to hear about, and I'll see you tomorrow. Bye-bye.